Welcome back to our channel. Today, we're diving into the second episode of our series on coronary artery disease, CAD. If you haven't seen the first episode, where we discussed the causes and symptoms of COAD, we highly recommend you check it out. CAD is a serious condition that affects millions of people worldwide, and it's crucial to understand it fully. In this episode, we'll explore different ways to manage CAD, from lifestyle modifications to medications, surgical options, and cardiac rehabilitation. So, stay tuned to learn more about how to live a healthier life with CAD. But before we begin, don't forget to like, share, and subscribe to our channel. Your support helps us create more informative content like this. Let's get started. For people diagnosed with CAD, it's often recommended they adopt a heart-healthy diet, low in saturated fats, cholesterol, and sodium. Regular physical activity is also encouraged, as is maintaining a healthy weight. A crucial aspect of managing CAD is smoking cessation. This is because smoking can worsen the condition by increasing the risk of plaque buildup in the arteries. Depending on the individual's specific condition and risk factors, certain medications may be prescribed. These can include statins, which help lower cholesterol levels and reduce the risk of plaque buildup, antiplatelet medications like aspirin to reduce the risk of blood clots, glyceryl trinitrate or GTN, which helps relieve chest pain by dilating blood vessels, beta blockers, which lower blood pressure and reduce the workload on the heart, and ACE inhibitors or ARBs, which are used to manage high blood pressure and protect the heart. In cases where lifestyle changes and medications are not enough, surgical options may be explored. One such procedure is angioplasty and stent placement. Here, a catheter with a balloon on the end is inserted into the blocked artery. The balloon is inflated to compress the plaque, and a stent is often inserted to keep the artery open, restoring normal blood flow to the heart. In severe cases where multiple arteries are blocked or angioplasty isn't feasible, coronary artery bypass graft or CABG surgery may be recommended. This procedure involves using a healthy blood vessel, usually from the leg or chest, to bypass the blocked arteries, allowing blood to flow freely to the heart muscle. Following treatment, patients often benefit from cardiac rehabilitation programs. These programs offer supervised exercise, education on heart-healthy living, and support for managing CAD. To summarize, coronary artery disease is a significant cardiovascular condition caused by the buildup of fatty plaques in the coronary arteries. This can lead to reduced blood flow to the heart muscle. The importance of early diagnosis and appropriate management of CAD cannot be overstated. This includes lifestyle changes, medications, and in some cases, surgical interventions. By working closely with healthcare providers to develop a personalized treatment plan, patients can address their specific CAD risk factors and symptoms, improving outcomes and reducing the risk of heart attacks and other complications.